The indications for balloon sinuplasty are for patients that have chronic allergy and sinus symptoms. Those symptoms would include chronic nasal congestion, chronic sinus pressure, sinus headaches, and especially patients that have chronic sinus infections, multiple sinus infections each year, one long-term sinus infection that antibiotics just don't fix. The balloon sinuplasty helps to get patients off of all those sinus medications and antibiotics. Balloon sinuplasty has been very successful. The success rates are well over 90% at significantly improving or resolving the sinus problems. 95% of the sinuses stay open long-term according to studies, and interestingly, over 95% of patients would recommend the procedure to their friends and would have it done again if necessary in the future. So balloon sinuplasty is performed in the clinic most of the time. We have an anesthesiologist come to the office once a week. He'll perform a little IV sedation and we'll perform the procedure. The procedure takes about 10 or 15 minutes. The balloon is placed into each of the sinuses. The sinuses are dilated for about 3 seconds and the balloon is taken right back out. The patient wakes up, goes right back home, and has really minimal recollection of the procedure itself. Balloon sinuplasty is actually very easy to recover from, mostly because we don't use any packing and because there's no actual cutting during the procedure. So the sinuses are dilated, there's minimal bleeding during that portion of the procedure. There's no packing placed, so there's no discomfort afterwards, and most people recover in a day or two with minimal problems. So during the procedure, we'll eventually turn the lights off in the operating room so that we can see where we are with the balloon. The balloon actually slides over a lighted wire and we'll see the light in the sinus. If the light is not in the sinus, we know we're in the wrong place and we'll keep working to get the lighted wire into the sinus before placing the balloon. Having the room dark helps us identify the sinuses easier and quicker. Balloon sinuplasty is a nice intermediate procedure. We typically treat sinus problems with antibiotics and allergy medications. And if that doesn't work, in the past we would go straight to the operating room and perform endoscopic sinus surgery, which is a bigger, more risky procedure. The balloon sinuplasty is nice because it's minimally invasive, it has virtually no risk, and it's very easy to recover from. And 90 to 95% of the time, it gets you off all of those antibiotics and most of the allergy medications that you're tied to.